I'm Dr. Matthew Karshner. I am a physiatrist, and I officially started my career in 1994. College was Kenyon College in Ohio, close to my hometown in Columbus. And medical school was Ohio State University College of Medicine. I had internship training at Medical College of Ohio in Toledo, and I did my residency training in physical medicine and rehabilitation at the University of Kansas Medical Center in Kansas City. From there, I went to New Orleans to do a musculoskeletal fellowship at Louisiana State University in New Orleans. I do several procedures. I do EMG and nerve conduction studies to look for problems with nerves in the limbs and nerve roots coming from the neck and low back. I do various joint injections for arthritides. I do trigger point injections for myofascial pain. And I also do botulinum toxin injections for spasticity and migraine headaches. I usually see patients who have low back pain, neck pain, muscle pain, joint pains, arthritis, basically anything that deals with the nerves, muscles, or skeleton is something in my territory and training capability. I do botulinum toxin injections for chronic migraine headache patients. It's working extremely well. Our success rate is somewhere between 90 and 95%. Part of that is due to the selection of the patients. They've been through various medications already that have either worked incompletely or not at all. And the effectiveness of the botulinum toxin is extremely high when you have selected these appropriate patients. Nothing else works for them, yet these injections done about every 3 or 4 months are working extremely well for the patients in either reducing significantly their headache intensity or frequency, or in a lot of patients getting rid of them almost completely. I get to be a mechanic for the human body. When I was growing up, I loved working on cars and determining how they ran and how all the systems worked together. I listened to car talk most weekends with click and clack and listened to the symptoms that the callers present and then try to figure out along with the guys what the problem is. It's kind of fun to do that, and I apply the same principles to my practice. You ask the who, what, why, when, where, and how, and come up with the most likely explanation. And if you need to, you can use imaging studies or laboratories to confirm your diagnosis and start treatment. This region has an awful lot to offer. I can take my kids bike riding along the trail along the creek, and 5.5 miles is enough to wear them out pretty well. I enjoy that, and they do too. There's all kinds of parks in the area with great scenery. There's natural resources of all kinds to look at and enjoy, and I enjoy the region. It is halfway between my family and my wife's family, so it works very well for visits either to them or from them.